The number of Minnesotans with Alzheimer's disease is expected to jump in the next 4 years. The Alzheimer's Association projects 120,000 Minnesotans will have the disease by 2025.
And that is why the association is teaming up with the Mayo Clinic tomorrow to provide a free online day-long conference to educate us all about the disease. Tim Blott's joining us now. And so, Tim, this is especially important for communities of color.
Oh, my goodness. And here's why, too. I'm going to show you some of these data sets from the Alzheimer's Association because it shows that blacks are 2 times more likely to contract Alzheimer's disease than whites. But they're only 34% more likely to actually get a diagnosis. And the same kind of carries over to Hispanics. Only 1.5 times more likely to get the disease, but only 18% more likely to get a diagnosis. So you can see the disparities there that are happening, and it's exactly why education about this disease is so critically important.
He was 53 when he was diagnosed.
Venerine Brown Boatswain's husband Cedric was young and energetic, but the tests confirming dementia sent them both back.
And my husband is a very, very bright guy, you know, and to see the work looked like a 2-year-old. So that was astonishing to me. And that's how we started this journey.
Cedric's early diagnosis allowed him to get important medical care, but many black families find barriers to navigate the disease, and one of those barriers is support. Venerine founded a group formed by the Volunteers of America, one especially for African American families.
And that's where I felt like I got the support, because I was talking to individuals that understood what I was saying. I was working with a social worker that understood what was happening and helped me to understand what is going on.
It's important because of persistent disparities. New research by the Alzheimer's Association shows across ethnic groups, people believe they will be treated differently in Alzheimer's care because of their race, color, or ethnicity. As high as 36% among blacks, 19% among Asian Americans, 18% among Hispanic Americans. They are all issues that the Alzheimer's Association and Mayo Clinic will talk about during a free day-long virtual conference on Friday. Carl Hill is the Alzheimer's Association's Chief Diversity Officer, who says people need to participate.
Because there's going to be great discussion around disparities and the ways to look at disparities. Is it lifestyle? Is it the context that influences people's lifestyle? And then the resources.
And those resources are all about where to turn if you suspect a loved one has dementia or Alzheimer's.
Information about how to get a diagnosis, how to see a doctor, because that can make a tremendous difference in going this continuum from cognitive decline to severe dementia.
Early diagnosis made a difference for Venerine's husband, Cedric, and she now says that knowledge is power.
Oftentimes, we don't have a good understanding of the disease. And the more you learn about the disease, the better you will be.
And the Mayo Clinic Conference on Brain Health and Dementia, it takes place tomorrow. Carl Hill's session on diversity, that happens at 10:20 in the morning. And because of the pandemic, the entire day-long conference is virtual and it's free. I posted the link for the registration on both our website, fox9.com, and my Facebook page, which is Timothy Blott's Fox 9. Kelsey?
All right, thanks, Tim.